Unfortunately, more and more I see children being diagnosed with Attention Deficit Hyperactivity Disorder, or ADHD. So why is this, and what can we do about it? Well, here's what the science says. Attention Deficit Hyperactivity Disorder is a brain condition, most commonly characterized by inattention, hyperactivity, and impulsivity. While some degree of inattention and hyperactivity is certainly normal in children, in order to be actually diagnosed with ADHD, symptoms must be severe, they must occur often, and interfere with daily functioning. The most recent revision of the Diagnostic and Statistical Manual, the DSM-5, distinguishes attention deficit hyperactivity disorder into 3 different subtypes. First, there's predominantly inattentive presentation. Second, the predominantly hyperactivity impulsive presentation. And the third is a combined presentation. Children with ADHD often have difficulty focusing and staying organized. They lack attention to detail, they make hasty decisions or act without thinking, avoid tasks that require sustained mental effort, they can get distracted easily, have trouble with social relationships, they're hyperactive, they can fidget, tap, or talk excessively, and interrupt others. And as mentioned before, the number of individuals, particularly children, diagnosed with ADHD continues to be on the rise. In fact, according to a 2016 report conducted by the Centers for Disease Control and Prevention, there are 6.1 million children aged 2 to 17 with ADHD in the United States. And unfortunately, a clear cause of the condition has really yet to be established. However, there are several factors that seem to be related to the prevalence, like genetics, and also gender. The condition is far more common in males than females, and males are about 3 times more likely to be diagnosed with ADHD. Exposure to smoking or alcohol or other environmental toxins such as lead during pregnancy, and low birth weight and brain injuries. Several other conditions, including learning disabilities, anxiety and depression, conduct disorder, and substance abuse, often occur alongside the ADHD diagnosis. And the same Centers for Disease Control and Prevention study found that out of 6.1 million diagnosed in the U.S., 2/3 of these children were also diagnosed with another mental, emotional, or behavioral disorder. Conventional treatments include medications, usually stimulants like Ritalin, but also might include psychotherapy and other training. And unfortunately, because the exact cause of ADHD is unknown, children and adults often depend on these pharmaceuticals to manage their symptoms and help their functioning. Some dietary and lifestyle interventions have shown a lot of promise. Several foods have been identified as triggers, while others seem to actually improve symptoms and functioning. The list of aggravating foods include, but are not limited to, sugar, gluten, dairy, food coloring and dyes, caffeine, MSG, hydrolyzed vegetable protein, nitrates, artificial sweeteners, and soy. So food allergy testing or an elimination diet can help to identify these potential triggers. Visit Fullscript's blog for a resource you can share with your patients on the elimination diet. Also, there are supplemental nutrients that have been shown to improve symptoms of ADHD, such as omega-3 fatty acids. There was a recent 16-week double-blind randomized placebo-controlled trial examining the effects of omega-3 fatty acid supplementation in 40 boys with ADHD, and it found that EPA and DHA combined improved parent-rated symptoms of ADHD. Similarly, another randomized double-blind placebo-controlled study noted a significant improvement in symptoms following omega-3 polyunsaturated fatty acid supplementation in pediatric patients with ADHD. There's also phosphatidylserine. A 2014 randomized double-blind placebo-controlled clinical trial found that administration of 200 milligrams per day of phosphatidylserine for 2 months improved short-term auditory memory and also symptoms of ADHD. And another study found that a combination treatment of phosphatidylserine and omega-3 fatty acids may also be effective in reducing symptoms such as restlessness, hyperactivity, and impulsiveness. Research has also shown that GABA concentration is significantly reduced in children with ADHD compared to children without ADHD. So this is where you could consider genetic testing. A pilot study assessing the nutritional status of children noted that children with ADHD consume significantly less zinc and copper. These are nutrients essential for the production of certain neurotransmitters. And another study measured mineral levels in the serum and hair of children and found that children with ADHD had lower levels of zinc, copper, and magnesium compared to the control group. In addition, certain lifestyle changes can help improve the functioning of children with ADHD. Getting enough sleep, exercising regularly, and being consistent and organized with them can help greatly. If you have experience with treating patients with ADHD, by all means, like this post and comment below so we can keep this conversation going. And for more information about ADHD, visit Fullscript's Practitioner Medical Education Hub at fullscript.com/HCP.